Meghalaya Legislative Assembly Speaker Thomas A. Sangma on Friday chaired the first meeting of the governing body of the reconstituted Meghalaya Legislators Forum on HIV/AIDS at the conference room of Pinewood Hotel in Shillong. Meghalaya Chief Minister Conrad Sangma, who is also the chief patron of the Meghalaya Legislators Forum on HIV/AIDS, Deputy Speaker Timothy D. Shera, Health Minister Dr. Ampreen Lingdaw, Opposition Leader Ronnie V. Lingdaw and legislators attended the meeting. 6 agendas in connection with people living with HIV were discussed in the meeting: healthcare access, social support programs, employment and skill development, education and awareness campaigns, nutrition support and legal aid services.
Governing body meeting of the reconstituted Legislators Forum on HIV/AIDS, where all the legislators are involved in combating this dreaded disease by way of giving awareness to the people, because this is not only about the medical issues but also the social, economic and social stigma issues are also involved, where legislators can help the people living with HIV/AIDS can be given support by way of bringing them into the mainstream of the social life. So we have today meeting was attended by Honorable Chief Minister, who is also the chief patron of this Legislators Forum on HIV, and all 60 MLAs are by default members of this part, and this is where we also have been requested by the AIDS Control Society to make some contributions to that, and we have agreed that legislators will give contributions from their schemes or maybe from their discretionary grants, and which will help in bringing awareness to the people. And we have also decided that all the 60 MLAs should be actively involved in this forum, so that we can go around to the most affected areas, give awareness and give our support. Mostly the support of the MLAs, legislators would be a great help. We felt that it would be a great help in combating this dreadful disease. So these are the few points that we have discussed, where the legislators will take active part in fighting this social problem of how to prevent the rise of this dreaded disease in the state. We are very much higher than the national level. Meghalaya is much higher. Meghalaya's AIDS, percentage of AIDS having people living with AIDS is much higher than the national level. National level is just 0.29, whereas we have, I think, 0.37, around something like that. There are state-sponsored programs also, and this is the Legislators Forum, which will jointly work together to bring down the spread of this disease in our state. So, Honorable Chief Minister also suggested that there are already programs sponsored by central government, sponsored by the state government, which should not be overlapping or duplicacy in this regard. So, legislators will work in a different level, where we can see, our approach would be slightly different to the regular or the routine works that the AIDS Control Society and the state government, whatever they are doing. So we will do it in a slightly different way to bring awareness to the people, and also maybe with the legislators' involvement, I think people of the state would be more aware, because there is very less awareness have been bringing. So we will do it in a different slightly different way. We will work on it. We will sit together again, and we will how we can do it, which will bring about a different outcome. This mission mode approach is very much the need of the hour, I would say, because whatever we do, we have been carrying out these kind of programs for quite a number of years, and it not been able to show some meaningful results or outcomes, I would say, where we could see the reduction of these cases. So we wanted to focus on specific areas where we can, suppose there are certain areas in our state where the number of these HIV cases are so high compared with other districts. So we will focus on these districts and work on as Honorable CM suggested, on a mission. Those are the few things that we will do so that we could come out with some positive outcomes within. We have also set up a timeline that within 2 years we should see some positive outcomes.
You see, this meeting basically is, to bring on board the legislators also. See, because it's, a pandemic that needs the, effort of each and everyone, including legislators. And I am very happy that, we have this Meghalaya Legislators AIDS Forum, because through us maybe, we can bring more awareness and avoid the social stigma. The biggest part for people suffering from HIV/AIDS is the social stigma. So maybe that is very important to work out also, to ensure that people are not stigmatized because they're suffering from this particular dreadful disease. So I think it's very important. Maybe we can contribute not only financially, but then of course, socially and in many other ways. Because I remember when the former speaker, Mr. Charles Pong, took us to Philippines, and we had a similar program on AIDS, and they were able to bring down the incidence of AIDS to a very, very low level with the participation of the NGOs, because Philippines is made up of thousands of islands. So it was not possible for the government to reach to each and every island in the country. So the NGOs contributed, and they were able to bring down, the AIDS pandemic under control, or rather reduce it to such a level with the participation of the NGOs. So I think we requested, we have in our society, we already have the Sing Samla, we have the Senglong Khmer, we have the Dorbashnam. Maybe if this society can work with them, then maybe we can bring about awareness about this disease, and then if those who have been afflicted with this, need not be socially stigmatized. So the Chief Minister's suggestion, advice has come at a very, very crucial time, because you must have seen, in the graph, whereas in other states this incidence has come down, in our state is on the rising trend. So I think needs more to be done, and it has to be on a mission focus mode. So we have a targeted approach, how to reduce the incidence of this infection. That's very important.